determination when I first went to the state legislature that I wanted to be involved in health policy to make a difference. And the big difference we need is that every American ought to have health insurance. The common ground that can unite us all. I have often said that in 1993 and 1994, we had a lot of groups that has their first choice universal health care coverage. But they wanted it their way, and their second choice was nothing. And that's what we got. And now all of these groups realize that was a serious loss for them and for all of us. What we're determined to do is to work to find the approach that will be broadly acceptable to the American people. And that says to me that we have to build on the system we have in place today, recognized by President Obama in his campaign and the outline of his approach. He would build on and protect the employer-based coverage that's now available. It lets people who have that coverage, that works for them, if they're happy with it, to keep it. And it strengthens the safety net of our vital public programs, Medicare, Medicaid, and S-CHIP. It gives people a place to go to get good, accessible, affordable, and regulated coverage through private plans. Or, if they prefer, they can go into a public alternative. We leave the choice to them. It recognizes the importance of prevention and wellness services and the management of chronic diseases, which make good sense for both a health and a cost point of view. So with that outline, when I look at the Commerce Committee that I now chair, I think this committee, which is the lead committee in the House to do health care, I think with just looking at that committee alone, it offers us that spectrum that we need to reach out to. We have 59 members, so our committee alone would represent nearly, if we looked at it in the Senate terms, it's nearly 60% of the members of the Senate, 15% of the House. It's balanced between urban and rural, conservative and liberal, new members and veterans. If we can get a consensus in our committee, I'm convinced we'd be pretty close to what will be a consensus in the House and the Senate. And as an aside for those who care about this issue, we're going to be moving our FDA regulation of tobacco legislation very, very soon. But they won't work unless we have strong rating and underwriting rules and an effective regulatory structure. So long as insurers can find ways to avoid insuring those who need it most, we will not have secured the goal of universal coverage. No tax credit or private product is likely to be able to provide the guarantee of coverage that these vulnerable people need and deserve. There are some who say that with this devastating state of the economy, we have to put off the goal of health care coverage for all, but I look at it in a completely different way. I believe it's necessary to restoring the health of our economy in order that we solve the problems of millions of Americans without health care. That costly failure of our healthcare system affects the financial health of our businesses. It affects the productivity of our workers. It affects our competitiveness in the world, and it affects every American family, insured and uninsured alike. This isn't something to put off. This is something to do right now to help fix our economy.